everyone, it's Dr. Katrina Mattingly, and I'm here to show you all what it's like to have to get ready to go in to see a suspected coronavirus patient. It takes a lot of resources, it takes a lot of time to get gowned up and geared up, so I'm going to show you what that's like. We call this donning our personal protective equipment, or PPE, which you've heard a lot about. So putting it on is usually the easier part because everything's usually clean, maybe with the exception of having to reuse your mask, which a lot of us are having to do to store in between each patient, particularly the N95 mask. So here I have my yellow gown. So that goes on first. Tie myself up here. Luckily mine is already enclosed at the neck here, so I don't have to tie anything up there. All right, and then you want to make sure that as much as possible, anything hanging kind of goes towards the back. And then next for me, I'm going to go ahead and put on my bonnet. That's easy. I'm going to go ahead and stick on my goggles. My N95 mask, making sure just to touch around the edges. One strap around the neck. And one around the top of the head. All right. Surgical mask on top to protect the outside of the N95. Now you can just go in like this if you're comfortable. If you want a little bit more protection, we also have something called a capper, which blows out air and positive pressure and surrounds your face. That way if somebody were to cough or sneeze in the room, the air coming from the mask would blow those particles away from you. So I'll go ahead and put that one on. Goes over the head. And then around the face. Then it plugs in to a unit here. And you can hear the air. Put that towards the back. All right, I'm putting on my gloves and I'm going in. I usually keep all this stuff outside of my room in a special tray I have lined up, and I keep my N95 and my mask in a paper bag after I've kind of sprayed it down and sterilized everything. Okay, and this is it. And then once we're done seeing the patient, we take it all off and sterilize it and make sure everything is clean. There's also disposable stethoscopes hanging outside of each room. So now you know all the necessary precautions you have to take in case we're going in to see someone with coronavirus. All right, talk to you later. Bye.